Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. We'll be discussing celiac disease. Celiac disease is a chronic autoimmune disorder triggered by the ingestion of gluten protein found in wheat, barley, and rye. In genetically predisposed individuals, gluten ingestion leads to an immune response that damages the lining of the small intestine, resulting in malabsorption of nutrients. Risk factors: genetic predisposition, family history of celiac disease, type 1 diabetes, mellitus, autoimmune thyroid disease, Down syndrome, Turner syndrome, microscopic colitis, selective immunoglobulin A deficiency, causes genetic predisposition, exposure to gluten in wheat, rye, and barley, immune system malfunction where gluten triggers T-cell activation and mucosal damage, environmental triggers, e.g., infections or early infant feeding practices. Pathophysiology. 1. Gluten is broken down into gliadin in the intestine. 2. Tissue transglutaminase, TTG, modifies gliadin, making it more immunogenic. 3. Modified gliadin is presented by HLA-DQ2 or HLA-DQ8 molecules on antigen-presenting cells. 4. This activates T cells, resulting in inflammation, villus atrophy crypt, hyperplasia. 5. Malabsorption due to loss of absorptive surface. Clinical manifestation in children less than 2 years. Chronic diarrhea, vomiting, failure to thrive or poor weight gain, irritability, muscle wasting, abdominal distension, delayed developmental milestones. Clinical manifestation from 2 years and above: abdominal pain, bloating and flatulence, diarrhea or constipation, iron deficiency anemia, fatigue and lethargy, short stature, delayed puberty, mouth ulcers, dermatitis, herpetiformis, itchy skin rash. Diagnosis: serologic tests, anti-tissue transglutaminase, TTG, IgA endomysium antibody, EMA, total serum IgA to check for IgA deficiency, small intestinal biopsy, gold standard, shows villus atrophy and crypt hyperplasia. Genetic testing: HLA-DQ2 and HLA-DQ8 typing, not diagnostic but helpful. Non-pharmacological management: strict lifelong gluten-free diet, GFD, dietary counseling with a registered dietitian, monitoring of growth and nutritional status, regular follow-up for antibody levels and symptom resolution, support groups for psychological and social support, pharmacological management, nutritional supplements, iron, folate, calcium, vitamin D, and B12 for deficiencies. Dapsone for skin manifestations, dermatitis, herpetiformis, corticosteroids in refractory or severe cases to reduce inflammation. Probiotics may help restore gut flora. Foods containing gluten, wheat and derivatives, e.g., bread, pasta, noodles, pastries. Barley, found in beer, malt. Rye, couscous, semolina, some sauces, dressings, processed meats. Gluten-free foods: rice, corn, potatoes, millet, quinoa, amaranth, fruits and vegetables, eggs, meat, dairy, unprocessed, certified gluten-free labeled products. Nursing management: assess gastrointestinal symptoms and nutritional status. Educate the patient and family about gluten-free diets. Monitor growth and development, especially in children. Emotional support for coping with chronic illness. Ensure medication and supplements are gluten-free. Coordinate with dietitians and the healthcare team. Monitor adherence to diet and evaluate symptom resolution. Prevention: No definitive method to prevent celiac disease. Exclusive breastfeeding may offer some protection. Avoiding early or late introduction of gluten in infancy. Introduce at 4–6 months. Genetic counseling for families with a history of celiac disease. Complications. Nutrient deficiencies. Iron, calcium, B12, folate. Osteopenia, osteoporosis. Infertility and miscarriage. Liver disease, lactose intolerance. Refractory celiac disease. Enteropathy-associated T-cell lymphoma, EATL. Other autoimmune diseases. Nursing diagnosis. Imbalanced nutrition. Less than body requirements related to malabsorption. Diarrhea related to intestinal inflammation. Fatigue related to anemia and nutrient deficiencies. Risk for impaired skin integrity related to dermatitis herpetiformis. Knowledge deficit related to gluten-free diet. Delayed growth and development in children related to nutritional deficiency. That's all for the class. Thank you for listening. Tutor, could you please explain how genetic testing helps in celiac disease diagnosis? Is it really necessary? Great question. Genetic testing identifies HLA-DQ2 and HLA-DQ8 alleles, which are associated with celiac disease. While it's not diagnostic, it helps in ruling out the disease if these alleles are absent. How effective is a gluten-free diet in managing the symptoms? A strict gluten-free diet is currently the only effective treatment for managing symptoms and promoting intestinal healing. I noticed there are many gluten-free options available nowadays. How do we ensure they're truly safe for celiac patients? Checking for the certified gluten-free label is a good start. It's regulated and ensures products meet safety standards for celiac patients. That's right. It's also important to be aware of cross-contamination risks in preparation and storage of these products.